Hi, this is Kirk, the bariatric carnivore. Well, look, I hate to tell you this, but being healthy is not really good for their bottom line. And when I keep saying that this system is set up as a psychopathic system, this is what I'm getting to. Where your health, your good health, is actually not good for other people's bottom lines. And frankly, not everybody in the system is set up, and they're not looking after your health. And this is not to say that I'm against medicine. I'm not. For acute illness, there's nobody else on the planet, no other place I'd rather live than right here in America. I think we have the best acute care system in the planet. When you've got sudden injury, they are fantastic. When you've got your appendix going out, they will take care of you better than anybody else. I've got right now a cataract. I know it's developing. It's got to be taken care of at some point down the line. But that is not something that diet and lifestyle is going to take care of. It's got to be taken care of by a medical specialist. And I trust the system to take care of that type of thing. But this is where it gets interesting. I'm not negotiating with them, and I'm not having to look at what specialist I'm going to go to get that taken care of based on what my insurance company will pay for. I'm looking at a couple of things. I get to look at a doctor, first of all, do they have experience in this particular area? What are the patient reviews on? And then looking at what are they willing to do it for. I'm in basically cost negotiations with doctors and saying, look, if I showed up, had cash in hand, how much would you do it for? And it's a significant difference. I mean, it's one guy said 10 grand, another guy said 2. Equal experience, lots of different, there's some variables to it, but basically, that's an $8,000 difference out of pocket. Just shopping around. You can do the same thing if you get yourself healthy. And if you don't have to worry about what insurance company you're utilizing. And this is where it gets really kind of tricky, but it's an important distinction. You cannot get freedom in this whole area until you get yourself healthy. So, and that really boils down to this. I mean, diet, some exercise, and your sleeping patterns are going to be probably care about 90% of the illnesses in this country. And I think that may sound like an overstatement to a lot of you, but really when you look at the number of chronic diseases, and these are the cash cow for the health industry. Chronic diseases are like type 2 diabetes are not something that can be taken care of with a drug. They can treat the symptoms. I mean, insulin helps lower your blood glucose, but it doesn't stop the blood glucose from going up. That can only be done through diet, reducing the carbs. That will do it. If you switch to a low carb diet, you can get off the insulin, and you're going to, by the way, if you're a type 2 diabetic who is on insulin, really be careful with this. You need to be working with somebody that knows how to de-prescribe and cut down your insulin levels. Because if you suddenly go to a low-carb diet with not carefully monitoring your blood sugar, and you're still injecting the same amount of insulin you did when you were eating chocolate cake, you're going to crash. You're going to cause yourself some serious problems. So, depending on the severity of it, you're going to need to be monitored and work with a medical professional. But if you want to prevent type 2 diabetes, or if you're not insulin dependent at this particular moment, switching to a low carb is going to get you metabolically healthy. And it'll probably take a few months, but boy, once that happens, you're now free. It makes a big difference. And when you're free of chronic diseases and you no longer have to see a doctor because you need to get refills on your prescription, then you can dump your insurance company. You can get a policy that only covers major catastrophic illnesses. You can put money away in a medical IRA for emergencies, but you don't have to be part of that system. Frankly, it is really interesting. the first time I showed up at a doctor's office, and the first thing they always ask is, okay, need your driver's license and your insurance card. And I'm like, well, okay, I'm not giving you my driver's license because you don't need it. I'm paying right now. And number two, I don't have insurance. I'm just paying for it. And all of a sudden they treated you very differently. They're no longer looking at a host of different things that they can get you socked up in their system. They're not ordering a bunch of unnecessary tests. They're looking at it going, okay, you've got this thing, let's take care of the thing. And they're done. They're not trying to suck you into the system. And that's freeing. And it's very powerful, and it gives you a lot more negotiation and latitude than you might think. If there's any time in the world history when people in take the United States of America, there's no excuse why we shouldn't be the healthiest population ever that ever existed. We have more knowledge, we've got more information, we've got more wealth than has ever existed in the history of the planet. Yet we are the sickest people, as far as I can tell, on the planet. We've got a skyrocketing rates of diseases that have never existed in world history. Heart disease is going through the roof. Type 2 diabetes, cancers are skyrocketing. It is horrible. Where we live in a country where 90% of Americans are metabolically unhealthy for at least one marker, and most of us suffer from at least one chronic disease. We're ridiculously unhealthy. Most people feel like crap. We don't even feel good. Yet we are paying more money than any other group of people in the history of the planet for medical care. We feel like crap, we're not getting healthier, and we're spending tons of money on it. What's the solution? Get out. Get healthy, get out of it, quit paying for it, and maybe if enough of us do that, we've got a chance to get them to start focusing on the things that really matter. But until enough of us get healthy and get out, they ain't going to pay attention, because frankly, your bad health pays the bills for a lot of different groups. Big pharma's depending on it. Government agencies are depending on it. The media is depending on it. Your doctor's depending on it. Medical systems are depending on it. A lot of people's bottom line depends on your bad health. And that's the psychopathic system that we've got. Remember, in this fight for your health, you are all alone in this, but we can all be alone in this together. There's a lot of great information out there if you're willing to do the work, and you can get yourself free. Can't highlight, and it is the most liberating thing in the world when you start to figure it out for yourself. This is Kirk, the Bariatric Carnivore. I try to put out a couple messages each week. If you like this message, hit the like and subscribe. Join this tribe. Grab with other people. Get yourself out of the system while you still can. I try to put out a couple messages each week. I will talk to you again soon.